Weight loss surgery has been in the headlines a lot lately, but how do you know what to take into consideration to find the best surgeon or procedure?
Health specialist Denise Dodor joins us with more information on what patients need to know.
They need to know a lot because it's very involved. Weight loss surgery is becoming more and more popular. But besides the most well-known procedure, lap band surgery, there are a few other options that may be more suitable depending on the patient. And there are a few factors you need to look at to find a qualified surgeon.
It's a way to live, and it's fabulous. I just feel terrific.
Getting to this point took a lot of work for 58-year-old Robin Wilk of Woodland Hills. This is a picture of Robin just a few years ago when she made an appointment to see weight loss surgeon Dr. Mark Paya.
I think if you have the right program and you have the right doctor and the right follow-up, it works. It absolutely works.
Weight loss surgery can come with risks because many who seek these procedures already suffer from chronic illnesses due to obesity. Dr. Paya says that's why it's important to be strict about screening patients before surgery.
We do blood work on chest x-ray, EKG. Sometimes we have to do echoes on their heart to make sure these patients are candidates for surgery.
Robin did a lot of research before she chose her doctor. Dr. Paya says look for a program that offers nutritional and psychological counseling. Plus, make sure a facility is designated as a center of excellence by the American Society for Metabolic and Bariatric Surgery.
Performing a lot of surgeries, you have great outcome, a very low complication rate. You're designated as a center of excellence.
Robin first had a lap band but had to have it removed due to side effects. Her options included the gastric bypass or the fairly new gastric sleeve.
We take the normal sized stomach and we reduce it down to a very thin, slender stomach that basically looks like a banana.
How successful and how well you tolerate any of these procedures depends on your age, how much weight you have to lose, and any medical conditions you may have.
But if somebody who's older, who's got diabetic, hypertension, hyperlipidemia, who needs to lose 150 pounds, we don't recommend a lap band for them.
Robin underwent the gastric sleeve procedure a few years ago. Since then, she's learned a whole new way of eating and lost 30 inches.
I lost all this weight. I got confidence, and I married a great guy, and life couldn't be better.
One of the most important things experts say is to have good rapport with your surgeon. Make sure he or she is willing to spend time describing and discussing the procedure, as well as how things may be after the surgery. And there are different kinds of procedures out there. Lap band, of course, is the most popular. But, talk to your doctor about which is best for you.
All right.
Okay?
Thank you, Denise.